Okay, so we're going to go over the hip bone and the different segments. So first we'll start with the ilium. The ilium is this top part right here, the whole flat area. Then I'll break it down for you. So then this part right here that I'm holding, it's kind of like a triangle, is your ischium. This, the part that kind of sticks out the front, another triangle, is your pubis. And then in the back there's a hole right here, and that's your acetabulum. So that's the different sections of the hip bone. So going over the ilium, which again is this top part, we'll go over the different things. How you tell what part is the front is this pubis bone right here. It's going to be pointing forward. So if it's back like this, that's your posterior side. So this is always in the front. So anterior. So first, this is the crest of the ilium. Then you have your anterior superior iliac spine. That's this part that comes out right here. So your anterior superior iliac spine. Underneath that is another little bump. That's your anterior inferior iliac spine. So now if you move the bone around to the back, on the iliac spine, follow it, you'll come to this bump. That's your posterior superior iliac spine. Underneath that, another bump, is your posterior inferior iliac spine. Going back to the front, moving it, right here is an indention, a depression. It's smooth, it's on the inside, so the medial side. That is your iliac fossa, right here. Now if you go to the back of the fossa, the iliac fossa, there's some lines, you can see them on this, they drew them on there. There's the bone kind of waves. So this first line right here, which sticks out, is your anterior gluteal line. So if you remember, this is your anterior. So the first part is your anterior gluteal line. When the bone indents, this line right here is your posterior gluteal line. And then underneath is your inferior gluteal line. So then shifting back to the front, this roughened area where it's really bumpy is called your sacral articulation. It's just all this bumpiness right here. And then under it is this indentation, and that's your sciatic notch, your greater sciatic notch. So then we'll go over your arcuate line. So starting at the bottom of the sacral articulation, you're going to go down right here, and then you'll come to this bump. It's kind of colored blue on this. So right here is an imaginary line called your arcuate line, and it goes to this bump. Now this bump here is your iliopectineal eminence. So your arcuate line goes to the iliopectineal eminence. Then from your iliopectineal eminence is another line, and it goes from here to here, and that's called your iliopectineal line. Okay, so then moving on to your ischium, which is down here, which I told you earlier. What I'm holding is called your body of ischium. This whole thing is just called your body. The spine of ischium is this little dot right here, this bumpy part. That's your spine of your ischium. The lesser sciatic notch is right under that. Right here, lesser sciatic notch. Then you have your tuberosity of ischium, which is on the back right here. Lesser sciatic notch, tuberosity of ischium. Then you have your obturator foramen, which is just the hole in the bone. Obturator foramen. And then last of all is your ramus of ischium, which is another imaginary line, and it just goes around the bone right here. So my finger is the line. Ramus of ischium. Okay, so now we'll go to your pubic bone, which is this front section right here. So the iliopectineal line we went over already, that goes right here. Then you have your superior ramus, which is another imaginary line that goes like this. It just wraps around like that. Goes around the whole bone, not the top. Then you have your pubic tubercle, which is this little bump right here at the top. Then you have your symphysis pubis, which is right here where all these black dots are. Both your bones fuse together right here, your hip bones. So your symphysis pubis. Then we already went over your iliopectineal eminence, which is right here again, the bump. Then you have your inferior ramus, which is on the other side of the pubis. So you follow it down and it's right here. Inferior ramus, it goes around the whole bone. So you got your superior ramus, inferior ramus. And then you have your pubic crest, which is this little ridge right here on the top of the bone. Your pubic crest. And that's your pubic bone, which is right here, part of your hip. Okay, so then last we have your acetabulum, which is this whole hole right here. So the rim of the acetabulum is this part right here. The rim. So like a basketball rim. Next you have your large fossa, which is the smooth surface that goes around right here. Your large fossa. Then you have your acetabular fossa, which is the smooth flat part right in here. And then last you have your acetabular notch, and that's just this little bump right in here. You'll be able to feel it, but it comes up. It's not like, it doesn't complete right here, it just is a little notch in there. And then that is your hip bone.